Welcome to Ask a Mental Health Expert. For Developmental Disability Awareness Month, we are exploring the programs of Integral Care's Intellectual and Developmental Disability, or IDD, division. Today, we are meeting with Ellyn Eisenberg, Program Manager, and Dan McClave, Service Coordinator, both on the Community First Choice program team. What is Community First Choice?
So Community First Choice, or CFC, is a program available to individuals with Medicaid who have an intellectual or developmental disability. The main service that it provides is attendant care. An attendant can help a person with their daily activities of daily living and help a person learn to do those daily activities as independently as possible.
How does the program work?
To get started, a person must complete an IDD intake and eligibility screening through their local authority. For Travis County, their local authority is Integral Care.
Community First Choice helps people receive personal assistant, attendant, or rehabilitation services in their own home. And a person can choose to hire their own staff, or they can select a provider from a list that's provided from their managed care organization. A managed care organization is just their health insurance. In some cases, family members may be able to be a paid provider as long as they're not the person's spouse or the legal guardian.
Basically, what the attendant care involves are two major forms of service. First of all, the attendant will be doing personal assisted service. Personal assisted service basically involves somebody helping with bathing, dressing, eating, a lot of those activities of daily living that you and I might take for granted we can do on our own. This also involves laundry, meal preparation. The other element of attendant care is something called habilitation. Habilitation is basically all those tasks that we mentioned earlier: bathing, dressing, eating. Habilitation is the portion of the attendant care where we teach the client to do those things for themselves as independently as possible. Habilitation also includes new tasks like going out in the community and finding their place in the community, something called community integration, or learning how to communicate better with other people, learning how to socialize, thinking of the future and making personal decisions for oneself, self-advocacy, things that might be new to a client. The other services that are also included in CFC are emergency response. An emergency response service includes an electronic system where the client can easily implement a call to either their caregiver or emergency services if they feel the need to. And then finally, support management, which is training on how to hire, manage, or dismiss attendants.
What should a person do if they are not connected to Community First Choice services and wants to be?
In Travis County, their first step is to contact Integral Care at 512-472-HELP 4357. Once you do that, you want to set up an IDD intake appointment. Of course, if you're already enrolled in IDD services, you just need to talk to your service coordinator to let them know you're interested in CFC.
Thanks, y'all. Remember, Integral Care's Helpline is available for free emotional support any time of day or night. Call us at 512-472-4357.